Welcome to this seminar about Elsevier Clinical Skills. My name's Maggie Nichol, and I've been involved in nursing for more years than I care to mention. I've been involved and working with Elsevier for many, many years, writing books. But this Elsevier Clinical Skills is quite a departure on that. And through those years, I've seen lots of times when nursing has been saying, oh no, what's going wrong, what's happening? But it feels like this year, maybe it's just because it's the latest one, but it feels like this year maybe we're facing one of our biggest challenges at the moment. And listening to some and seeing some of the sessions you've got here, it looks like a big, big challenge ahead of us. We've been getting some very sad headlines, haven't we? We've got a degree, about time too, why aren't we degree nurses? And then there's headlines like, you're not too posh to wash. Nurses now, after the Francis report saying all nurses should train as a year as a healthcare support worker before going into nurse education. I know that's being debated here, so whether that ever happens, they obviously haven't thought it all through, but it's saying that something needs doing. Peter Carter talking about how many jobs are being axed, and I know he's also saying he's having to stand up, having had really quite a tough year for nursing and our image. And then the mid-staff's report, which has made very sad reading, I think, for all of us. But quite often what you hear is, the problem is nurse education. They're not getting the right people in, and then they're not training them properly. So that all you need to do is to improve nurse education, and then everything will be tickety-boo. So the RCN commissioned Lord Willis to look into nurse education and to find out what it was, what would excellent nurse education look like for 2013 and beyond. But what Lord Willis found was that there was nothing, there was no major shortcomings in nurse education that you could lay at the door of saying, this is why it's all going wrong, this is why care standards are so poor. Now, that's not to say there's nothing wrong with nurse education. As a nurse educator, we all know there's all things to improve, but what it does mean is it's not that simple. It isn't just about curing nurse education, then we've cured everything else. One of the things that Lord Willis did say is it is imperative that nurses are provided with the right education and skills to enable them to fulfill their role. And I think that's one of the key things. We've got a lot of challenges facing us. I don't need to tell anybody in this room that demands on your time is getting greater and greater. And 81%, I'm surprised it's only 81%, quite honestly, who are doing more work, unpaid overtime. It's always hidden, isn't it? This unpaid overtime, just to get your job done. Training staff on wards, which is increasingly being expected, is getting more and more challenging, especially when 197 nursing posts are lost every month. And that's reported in this year. Not last year, not the year before. It's been going on year, month after month. And you'll know yourself if somebody leaves, it takes ages and ages before anybody's replaced. Practicing nurses are covering more duties and consequently suffering from more stress. It's always been a stressful profession, hasn't it? But it's now seems to be really getting more and more stressful, particularly when we're getting so much bad press from everywhere. Everybody's trying their hardest to do the right thing. And if somebody's off sick with stress, then of course that's more stress on the nurses who are covering for them. Financial constraints, whichever government's in, these are never going to go away. It cost, I was looking this up, that when the NHS was started in 1948, I wasn't quite around then to see the beginning of it, but in real terms today, the budget for the NHS in 1948 was the equivalent of about £9 million today. The budget for the NHS this year is 109 billion. So they're always going to be looking at ways to save money. We've had money thrown at it. it doesn't always convert into patient care, and it often, certainly doesn't convert into nursing and nurses' posts. And again, I don't need to tell any of you about the time constraints, and getting study leave and time to go off and get your skills improved is getting harder and harder, isn't it? Getting to go to a conference, you have to have something accepted to be able to get there at all, then you have to pay half, go in your own time, etc. So life is getting tougher, not easier. And then just when we thought, can it get any tougher? Along came the Francis report, which made very, very sad reading, didn't it? Very sad reading. And it would be, with all its 290 recommendations, I hope that the detail doesn't get lost in those 290, quite honestly. But when I read it, I don't know how many of us in this room could say, oh, that would never happen in my place. I don't think many of us could. And so that tells us we need to do something about nursing before we lose sight of what it's all about. And the Francis report is the latest, but it's not that new. 150 years or so ago, my heroine, Florence, she was saying much the same thing. And when you read her notes on nursing, it is extraordinary. I did something a little while ago, matching it with standards of care. And it's extraordinary how many things are still an issue that were an issue in her day. So we somehow got to take stock and think, okay, this isn't new. We know it's been going on. We know it could be happening somewhere close to us. So what do we do about it? It's not enough to just wring our hands and say, isn't this terrible? We need to do something about it. So I've been working with Elsevier and with my colleague, Chris Brooker, who's lurking over there. And we've had a lot of experience of writing and editing, but this is a very new venture for us, and we're just about recovering. What we felt was needed with Elsevier was something that provided evidence-based. Everything has to be evidence-based, doesn't it? And everything has to reflect the best practice guidelines as well. We wanted something that would demonstrate, not just talk about, but demonstrate real-life nursing skills that people are having to learn and having to do every day. Wanted something that would allow training to be taken at any time, because it's not always easy to release staff from wards, but also, even if there is training out there, it may not be at the right time. If you've got a problem that's just happened, you need training now. Or if you've got a special patient coming in with specific needs, you need that training now. A product that provides central feedback will help, because that means that it can feedback training data straight into your clinical governance facts and figures, and hopefully cut out a piece of paper. And we've just been hearing as well a survey of nurses to how much paperwork they're having to do that isn't directly to do with nursing care, but to do with all the standards and the targets and all those things you're having to do. And of course it has to be cost effective, because no one is going to entertain looking at anything that isn't cost effective and good value for money. So what we come up with? Something called Elsevier Clinical Skills. It had a baby brother, I guess it's called a baby brother or sister, baby sister that was called Clinical Skills Online. Some of you may have come across. But this is a product that tries to meet those needs. First and foremost, it is evidence-based. So all the skills included in here, and in the bag on your seat, and if you haven't got a seat, you haven't got a bag, I'm afraid, but we'll get one to you. You will find a list of all the skills that are included in here. Has to be based on evidence. So with the every skill, there's references, and because it's online, it can link straight through to websites and other resources, and if there's online references available, it can link through to that. It includes step-by-step videos. And as you can see from this is an example. I'll just go through this one. Take the receiver containing the syringe, the ampule, and the alcohol-impregnated swab, plus the sharp spin to the patient.
Check the prescription with the patient's name band and check the medicine again. Now put on your gloves. Select the site and assist the patient to adopt a suitable position. Identify the middle third of the thigh by spreading the fingers of one hand from the knee and of the other from the hip. Clean the skin thoroughly with the alcohol-impregnated swab and allow it to dry. Pick up the syringe and allow the needle cover to slip off into the tray. Using your non-dominant hand, stretch the skin between the forefinger and thumb. Warn the patient, and holding the syringe like a dart in your dominant hand, insert the needle swiftly and firmly at an angle of 90 degrees to the skin. Leave about 1 centimetre of the needle exposed so that it will be possible to remove the needle in the event of a needle breakage. Hold the coloured part of the needle to prevent movement. Withdraw the plunger slightly to check that the needle has not inadvertently entered a blood vessel. If blood does appear in the syringe, withdraw the needle and start the procedure again with a new syringe and drug. Depress the plunger steadily, not too quickly, until the syringe is empty. Smoothly withdraw the needle from the skin and press firmly on the site with the swab. Discard the syringe and needle immediately into the sharps bin. Check the site for bleeding, and then remove your gloves and document the injection according to local policy.
So that gives you a flavour of the step-by-step approach of these skills. And the great thing about a resource like this is normally if you're teaching a student or a junior member of staff, you show them very well, but then they have to remember it. And they have to rely on memory. What was it she did? Did she pull back on this one? Was that the subcut injection? This provides a permanent resource that student, that junior member of staff can go back to again and again. And I don't know how many of you have given IM injections recently. It's very few and far between, but suddenly you need to. So it's just an example. Each skill is also accompanied by a self-test quiz that will pick out certain aspects of the knowledge so the students can test themselves. And it's also got a checklist here. Now the checklist can be used online or you can print it off and use it. And that's either for the mentor or the teacher or somebody who's assessing the student, or the students can use it to assess themselves, or healthcare assistants assess themselves and then come to you saying, right, I've done my test, I've been assessed, I'm ready for you to assess me. This is the techie bit now. It can be integrated into your learning management system, or it can stand alone. I'll say no more than that, because I don't understand any more than that, but it means it can go into your own learning management system, or you can have it as a standalone product that doesn't need to fit in. And one thing that we found when we had clinical skills online, people said, but we don't do that like that. There's one bit there that we don't do like that. Or it might be that, certain nurses aren't allowed to do that, or we use a different dressing, or we use a different cleansing solution. Well, this is now customizable, and I think this will show you that you can actually go into the administrator, not every user, but the person who has administrator rights can go into a skill. The example here is blood transfusion, because in some areas you have to have 2 people checking blood. In some areas you have 1 person, which is the guidelines from the Transfusion Society. This is showing you that you can go in right in there, that comes up as the alert at the beginning of the skill, or you can change something in the equipment list, or you can change and so you can also put an alert saying only if you've done X training can you do this skill, or something like that. But you can go in and actually customize it, which we think will be really, really helpful and make it much more user-friendly, because you can put in things that you want in there. Of course, it's flexible, so you can do this anywhere you are. I know that getting access to a computer on duty can sometimes be challenging, certainly for more junior levels of staff. This means that I know that some trusts, I think, give people time off, like holiday time, because they just do their training in their own time. But it also means that somebody wanting just to revise something can do this wherever they are, and they can use with just a single login across multiple sites. So you're not having to keep logging into every skill. Just one login gets you into the product. So let's just see how that would work. So you're working in wherever you're working, because wherever you work, I think now you'll come across students or healthcare assistants or somebody needing training, and you have to assess their hand washing technique. Still, I mean, even Florence was talking about hand washing. We're still talking about hand washing in 2013, and we still don't get it right. So you need to assess your student, but you're very busy. So one of the benefits of something like this is when you know those days when you have no students or HCAs, and then the next day you've got 10. Don't know why it happens like that. Well, you can send them off to go and look up things and use the time very valuably. So we could send the student off to have a look at hand washing. Yes, so they're logging in at the top. They can then say, remember their password, so hopefully they don't have to keep remembering. You have so many passwords these days, it's hard to remember. Go and either look up a word, or they can use the alphabet there and just click on and just scroll through and browse through what's in that area. Then they can have a look at the quick sheet, ideally go to the skills overview, because that, as you can see, has got a lot of information in there. It's talking about standard precautions in a skill like hand washing. It's talking about what they need to prepare for the skill. There's the procedures there with rationale for every step. So it's not just telling them what to do, it's telling them why to do it. Then they can go off to the quiz, which was very quickly there, and then to the checklist, which either now the person assessing them, the mentor, can use this to assess them and use it online, or else, as they print it out if they wanted to use it. And then you can go up and print this. And so you could either be using this, or your student can come and say, I've done this, now I'm ready to be assessed. So hopefully they should be sailing through your assessment rather than you having to send them away. The other thing that this will give you is ideas for what can I ask them? What questions shall I ask them? And the student really should have quite a good understanding of the issues surrounding hand washing, not just the technique itself. Another example, if I can get back here, might be that working in any clinical area, and suddenly, including in the community, you find that you've got a patient with either a condition or some sort of equipment that you haven't seen for ages. And I just read yesterday somewhere, maybe it was in your things here, that somebody was sent home and the district nurse didn't know that the patient had a chest drain in. Well, I wouldn't think district nurses see chest drains very often. The example I'm using here is if suddenly, and again in my day, probably mostly, if you had a tracheostomy, you were in high dependency unit or ITU or maybe the ENT ward. Nowadays, you can have a tracheostomy anywhere. Anybody can. Not anybody, you know what I mean. So this would enable you to go off and think, oh gosh, I haven't looked after a trachea for ages. Go through to Elsevier Clinical Skills, select tracheal suctioning, have a quick look through the skill. Again, just remind yourself, have a look, what equipment do I need? The demonstration, again, will show you step by step how to do it. Go through the quiz if you've got time, because that just thinks, have I understood it? And then you're ready now, next day, to go and care for your patient with much more confidence than you would have had if you've just had to go and read about it. And that does actually showing the suction catheter going into the trachea, or not into the through the tracheostomy. So I hope that that gives you a flavour of what Elsevier Clinical Skills looks like. And are there any questions, please?